Welcome back to Therapy Thursday. Just finishing up reading this excellent book on Marcus Elliott, Dr. Marcus Elliott at the P3 Institute in Santa Barbara and Atlanta. They were kind of the first people to integrate things like force plates and motion capture in terms of their assessments, particularly on professional athletes, and to proactively look at injury risk assessment. One thing that becomes very apparent is specifically with knee injuries and catastrophic ones, like think Derrick Rose's ACL or Zach LaVine, they look specifically at the foot and ankle and up higher at the hip. One little trick amongst the many in that book in terms of preferentially loading the hip that I liked and we're starting to incorporate a little bit more in clinic is utilizing overload on common simple exercises. An example, the side plank. We typically think of that as a core exercise for the downside flank. However, they utilize it with some overpressure to strengthen the downside hip more. So what does that look like? We'd get you down into a typical side plank position like so. However, instead of just having your top hand on your hip, they would overload you with weight. This is just a simple 10-pound plate, but you can certainly go heavier than that. Right as soon as I put that weight on my hip, I can feel much greater activation on the outside of my hip in the area of the gluteus medius. Now, there are a number of ways to train the side plank. You can either hold it for prolonged periods, or often we give out what's called the reverse pyramid. So we might have somebody hold 15 to 30 seconds on one side, take a short rest, and go right back up, say for 5 repetitions, switch to the other side for 5, then come back to the original side for 4, switch again for 4, 3, 3, 2, 2, 1, 1, in an effort to greater fatigue the hips specifically. So next time you're trying the side plank and you're bored with it, or if you preferentially want to start to try to gain a little bit of hip strength, try a little bit of overload. I think you'll find it very, very effective. We'll see you next week on Therapy Thursday.